Greetings, my name is Andrea Hickel. I serve as overall study coordinator with the 10,000 Families Study, which I've been doing since 2019. I joined 10K Families because of its broad, ambitious approach to health and its commitment to including families from all Minnesota communities. My background is public health. I've been at the University of Minnesota in various roles and parts of the health sciences for over 20 years now. I'm very committed to health equity and the importance of working with and listening to communities. I'm not originally from Minnesota, and I've lived in different regions of the US and even Nicaragua, but I have lived in Minnesota for most of my adult life, and I'm quite attached to Minnesota and the many wonderful things about it in spite of the extreme weather. My family is here, and even my in-laws moved here from Florida.
Hi, my name is Clement Welkex. I am originally from Colombia, South America. My native language is Spanish. I am an industrial engineer. I live in my house in St. Paul, well, actually an apartment in St. Paul with my husband and my little four-legged kid, a cat named Leo Wilcox. I am the engagement specialist for the 10,000 Families.
Thank you for being part of this listening session today. Your voice will make a difference in the 10,000 Families Study. We want to hear feedback from people. What would make the 10,000 Families Study participation process easier and better? What are some of the barriers people see? How should we reach out to people about the study? How should we share study updates and results? We'll tell you more about the 10,000 Families Study and our new project focused on exposure to common contaminants in the environment very soon.
Thank you, Andrea. Another reason why it is important to participate in studies like that is because people from minority groups like me, either because we live in rural areas or because we are people of color, when we don't participate in studies that later on give results, then those results don't really apply to us. For instance, have you tried those medicines that when you take them, they are supposed to work in a certain way and they don't work on you? It might be because those medicines, and when they were doing research for those medicines, there was not a lot of participation of people who look like you or live where you are. So that's why it's very important to talk about this study today. Andrea, can you tell us what this study is about?
The 10K Families Study is looking at the influences of lifestyle, genetics, and environment on health and disease in families across the state of Minnesota. A family study is the perfect way to get at all these factors, even among families that don't have a biological relationship or that don't all live in the same household or even the same community. We're looking at people's health over time to see what happens, who stays healthy, and what kinds of illnesses and health conditions come up for people. What runs in families? There are lots of questions. 10KFS was founded in 2017 by a group of University of Minnesota researchers who had long wanted to launch a multi-generational study of family health focused on Minnesota. It should last for many years to really deliver on our goals. We want 10KFS's findings to inform public health and healthcare in all communities. So that is why we are inviting families from all communities across the state to join us. If some are not included, what we learn may not really apply to them. 10KFS collaborates with the University of Minnesota Extension, the organization HACER, which stands for Hispanic Advocacy and Community Empowerment Through Research, and other community organizations. Community partnerships are key for us to reach all communities and ensure that this study works for them. We have a new grant from the National Institutes of Health now. The goal of the new project is to understand the future health impacts of common environmental exposures that are of concern in Minnesota, especially radon gas, glyphosate, which is the key ingredient in the pesticide Roundup, which is used in many places, and PFAS, which stands for poly and perfluoroalkyl substances found in many household products. And in particular, we are looking at the development of cancers. An important part of the project is working together with and including the voices of communities that often are not included in research: rural, urban, and suburban areas, and BIPOC or Black, Indigenous communities of color, and others. Clement, can you share who can participate and what they need to do for 10,000 families?
A person who is 18 years old and live in Minnesota will fill out a questionnaire to see if your family is eligible. When your family gets invited to the study, this person invites a second member of the family or registers a child. After that, they fill out, all of them, a questionnaire about health. The third step is a family visit, which is like a doctor's visit, where we would take some samples of blood, saliva, and other things. And you will be sent home with a kit to measure the radon and the water in your house. You also would take a wristband to measure what you are exposed to. Andrea, what information is collected in those questionnaires?
Our main questionnaires are for adults and children about health habits, personal and family health history, social and environmental factors, quality of life and activities, and children's growth and development. And we ask people to complete a questionnaire every 2 years. We're also adding some questions to find out about where people have lived in recent years, which may impact chemicals they've been exposed to for our new project. We're also adding a questionnaire for adolescents ages 12 to 17 called our Teen Survey to get at teens' experiences in school and socially and health habits. Our plan is to ask teens to do it every year through age 17 so we can see how things change over time for them. Clement, what happens at the health visit?
At the health visit, you and your family members will provide some biological samples, including some blood that will help us understand how's your health state. Additionally to that, at the end of the visit, we will provide some kits to measure radon in your home, and also a wristband and a container to collect water at home. In order to reward participation, we have some gift cards to give away to participants. When you fill out your questionnaire or your child's questionnaire, you will receive a gift card. Also, when you attend a family visit and when you return the kids to be tested.
We think that in addition to some compensation for people's time and getting health information on your results, there are some broader reasons to take part in the 10,000 Families study. First, contributing to science to improve communities' health. It takes a village. Second, especially with a multi-generational study that should run for many years, contributing to the health of future generations. And finally, making sure that your community is included so that what we discover will benefit your community.